Hi, my name is Allison Cornelius. I'm a USA nursing student and I'll be performing the NG tube insertion video for you today. So here's my ID and scan the room. So the first thing I do is verify my order, verify hospital policy, and perform hand hygiene. Then I identify my patient with two identifiers. So I have Jaguar J. Jones, date of birth 8/25/1963, and MR number 4176352. And I see the allergies are penicillin. It says that as well on the bracelet. Then I'll ask my patient if they had any other allergies. Then I explain the procedure to my patient, provide privacy, gather all my equipment, and place it on a working table above my waist level. So right now I'm working below waist level, but in a hospital setting I'll be working above the waist level. Then I'll put on my goggles and perform hand hygiene and raise the bed and lower the side rails. And I take vital signs, O2 sats, and also take my bowel sounds. If my O2 sats decrease or if my vital signs deteriorate at all, then I would stop the procedure and do it again when my patient is stable. So then I make sure my patient is in high Fowler's position, and I establish a cueing sign with my patient for them to let me know if I need to stop insertion. So then I open my package, my NG tube, and I place some dollop of lubricant onto the package, and I prepare my tape, which I've already prepared my tape for the procedure. So then I make sure my 60 milliliter syringe is loose, is ready to go, and then I put on my clean gloves. So after I put on my clean gloves, I assess which nair is patent. So I'm gonna have my patient occlude one nostril and breathe regularly, and then I'll occlude the other nostril and breathe regularly, and then I'll decide which one I should do the procedure on. So today I have chosen the left nair. Then I clean the bridge of the nose with a alcohol swab or soap and water. So now that I've done that, I can measure my NG tube, and I've already done that in another video, and I already marked it with tape, with a dog-eared tape. And I place my towel on my patient's chest, and I grab a basin and place it on their abdomen to hold the end of the NG tube and catch any possible misses. So I'm gonna grab my NG tube and coil it around and place it into my basin, and I'm gonna lubricate the first 4 inches. Then I will begin insertion, so I'm gonna have my patient lay their head back and insert it with the curved end downward, and I'm gonna insert it slowly and gently. Once I reach the nasopharynx, I'm gonna have my patient lean their head forward and relax, and have them drink some water. And if they can't drink water, then I'll have them dry swallow. So if my patient, I'm gonna enter this 1 to 2 inches, every 1 to 2 inches at a time. I'll be turning at 180 degrees. So if my patient began to cough, then I'd withdraw the tube until I reach the nasopharynx again. So if they began to cough, if their O2 sats decreased, or if they had any respiratory distress, I would do that, and until it reached the nasopharynx again, and then until the patient started breathing normally. Then I would begin inserting again, instructing my patient to drink the water or dry swallow. And I'm making sure I'm not forcing the tube or pushing against resistance. So I'm going until I reach the tape that I measured with. That's what we found out. So once I reach the tape that I measured with, I will place it with a temporary tape on their cheek, secure it anyway. Then I will assess if I did the placement correctly. So I'll take my pen light and a tongue blade and look inside their throat to make sure that I placed it correctly. And another way I can do that is taking my 60 milliliter syringe and attaching it to my NG tube and aspirating for any gastric contents. And I could also assess the pH, and I could also have an x-ray if it's ordered. So now I will secure the NG tube to the patient's nose. So I'm going to skin prep so the tape doesn't get stuck on the patient's nose later on. So I'm going to skin prep. And I'm going to attach it with my tape that I prepared and make sure that it's loose enough so that the tube isn't going to be pulled on at all. It's more like comfort for the patient. Okay. So I'm going to attach it to the bridge of their nose. And I'm going to attach this part to the tubing itself. I'm going to remove that temporary tape that's marking the end measurement. Okay, I'm going to take that off. Making sure that tape is secure right here. And I'm going to take the temporary tape off that's on my patient's cheek. Then I will attach a clip to the patient's gown, like right here, to make sure my patient will be able to move their head freely without pulling on the tube. So now that I've taped and attached the clip, I can begin suctioning because that was ordered. So if I did not have suction ordered, I would just cap it like this. But since I have suction ordered, I'm going to attach it to the suction tubing. And I will turn the wall suction on to low intermittent suctioning, and I will have my blue pigtail rest above the stomach level. Okay. Then I would, now that my patient's in a comfortable position, I would lower the bed and raise the side rails, and making sure my patient is, head of the bed is 30 degrees, elevated 30 degrees. Make sure the collar is within reach and that my patient is comfortable. Then I can get rid of all my supplies. And I would remove the towel, but since I'm going to be demonstrating how to take the discontinue the nasogastric tube, I'm going to keep it there for that sake. But in the regular hospital setting, I would remove the towel for this procedure. Now I'm going to take off my gloves, glove to glove, and skin to skin, and perform hand hygiene. Then I would document the type and size of the tubing, the time that the procedure took place, the location of the procedure. So in this case, it would be the left nair. And then I would document how I secured the NG tube, how if I verified the appropriate placement, the suctioning, and then I would document how the patient handled the procedure. And I would also document the amount, the color, and the characteristics of secretions. And I forgot to say that I would mark the exit part of the exit site of the tubing with an indelible marker to as a guide for tube displacement. So I would do that after I secured the tape and secured it to the gown. So now I'm going to demonstrate how to discontinue a nasogastric tube. So the first thing I do is look at the order and verify that I am going to discontinue. I'll perform hand hygiene and explain the procedure to my patient. Then I would assess for bowels. I would auscultate for bowel sounds with my stethoscope, and I would discontinue suctioning. Then I'm going to remove my tape. I would unclip it from the gown and remove the tape. Carefully. I would also have my clean gloves on for this. So I put on my clean gloves after I perform hand hygiene. So then I would instruct my patient to breathe and hold their breath while I slowly and steadily remove the tube. Okay. Now that I have it removed, I can measure the drainage, perform oral hygiene, and document.